Understanding the VA hospital system and how to access its benefits can sometimes feel like navigating a maze. This guide aims to provide a clear and concise roadmap to VA hospital care. Whether you're a recent veteran or a seasoned one, understanding your eligibility is the first step. Let's begin. To help us support veterans and get the word out, like, subscribe, and share this video. Watching to the end helps. Thank you. The cornerstone of VA healthcare eligibility is service in the United States Armed Forces. Generally, to be eligible for VA healthcare, you must have served on active duty in the Army, Navy, Air Force, Marine Corps, or Coast Guard. This service must have been for a minimum period, typically 24 continuous months, and you must have received a discharge other than dishonorable. However, there are exceptions to these general rules. Veterans who served during specific wartime periods or were discharged early due to service-connected injuries might still qualify. Other factors, such as combat experience and disabilities incurred during service, can further influence your eligibility. For veterans who faced the crucible of combat, the VA recognizes the unique sacrifices they made. Veterans who served in designated combat zones or engaged in combat operations may be eligible for expanded VA healthcare benefits. This includes access to a wider range of services, priority scheduling for appointments, and specialized programs tailored to their unique needs. The VA provides dedicated mental health services for combat veterans, recognizing that addressing these invisible wounds is crucial for their overall well-being. Furthermore, combat veterans might have been exposed to environmental hazards during their service, and the VA offers specialized screenings and treatments for these conditions. The VA recognizes that many veterans carry the scars of their service long after they've left the battlefield. These scars might be physical wounds or invisible wounds like PTSD, or illnesses caused by exposure to hazardous materials. A service-connected disability is any injury or illness that was incurred or aggravated during a veteran's active military service. The VA has a comprehensive system for evaluating and assigning disability ratings, which determine the level of benefits a veteran receives. Veterans with service-connected disabilities receive priority access to VA healthcare services. This means they are placed higher on waiting lists for appointments and may be eligible for specialized programs tailored to their specific needs. The process of obtaining a service-connected disability rating can be complex, but the VA has resources available to assist veterans through this process. See our video on Certified County Veteran Service Officers, or VSO. The VA is committed to providing timely and effective care to these veterans, helping them manage their conditions and improve their quality of life. While service history and disability status are primary factors, the VA also considers income and assets when determining eligibility for certain healthcare programs. This means-based approach ensures that veterans with the greatest financial need receive priority access to care. The VA uses a system similar to adjusted gross income to assess a veteran's financial situation. Based on this assessment, veterans are assigned to different priority groups, which determine their co-payment obligations and eligibility for specific programs. It's important to note that not all VA healthcare services are subject to means testing. Emergency care, treatment for service-connected conditions, and some preventative services are generally provided regardless of income. Enrolling in VA healthcare is a straightforward process, and veterans can apply online, by phone, or in person at their local VA medical center. Again, your VSO can help with this. Once enrolled, veterans gain access to a comprehensive network of healthcare providers, facilities, and services. The VA continuously evolves to meet the changing needs of our nation's veterans. The PACT Act, signed in 2022, expands VA healthcare benefits significantly. It addresses health effects of toxic exposures for veterans from Vietnam, Iraq, and Afghanistan. Over 3.5 million veterans exposed to burn pits and Agent Orange benefit from this act. The VA also expands telehealth and mental health services to reach more veterans. You served and earned this benefit. Use it. VeteranFocus. Subscribe to help spread the word.